Today I discuss about the very important topic that is known as drug and receptor. Actually, drug and receptor include content of the pharmacodynamics of the pharmacology. What is the pharmacodynamics? Pharmacodynamics is defined as the what drug does to the body. मतलब after the absorption, drug is in a systemic circulation and then bind to the receptor, and after then give the some response. So what is receptor? Next, receptor is the specific type of protein that having the capacity to recognize any molecule and give the response. That is known as receptor. Content of the this lecture: first is the introduction of receptor, second is the drug receptor binding, third is the ligand gated ional channel G protein couple receptor, after then kinase link receptors, and after nuclear receptor, and comparison of their various type of receptor, and conclusion after that references. Next, what is the receptor? Actually, receptor is the specific protein that content of the cell that having the protein macromolecule and having the specific character to binding of any drug, and after then selectively give the some response. That is no receptor. Next, effect on the basis of their effect of the drug. It is divided in two part. The function of the receptor, two factors होते हैं. First is the affinity, second is extrinsic activity. What is the affinity? Ability या tendency, the binding of drug to the receptor. The drug receptor complex, that is known as affinity, and ability of the drug to trigger the pharmacological response of the drug that after the binding to the receptor, that is known as extrinsic activity. Okay, next, the based on the affinity and extrinsic activity, the drug is divided in four types. First is the full agonist. Full agonist, it means high affinity and high extrinsic activity. Extrinsic activity equal to 1. मतलब फुल एफिनिटी है और फुल जो है एक्सटेंसिव एक्टिविटी है. एंड that their example methacholine, acetylcholine bind to the muscarinic receptor, give the full agonist type action like affinity and extrinsic activity both are full. And after the agonist, after the antagonist having the जो है only affinity but extrinsic activity 0. Their example atropine on the muscarinic receptor that give the no response. Next, this is the receptor and that chemical drug that bind to the receptor enhance the cellular activity, and antagonist drug bind to the receptor and block the cellular activity. Next, after the partial agonist, full affinity but extrinsic activity less than 1 or between 0 to 1. Their example naloxone on a opioid receptor, and naloxone on the opioid receptor after the binding they produce some maximal response, that is known as partial agonist. And after the inverse agonist, full affinity but extrinsic activity less than 0, that is example beta cobalamin and benzodiazepine receptor. These examples are indicate the inverse antagonist. Next, the graph of the representation of the full agonist and partial agonist. They have the concentration of drug, and this is the response in percentage height. The full antagonist, the Cmax 100%, but partial agonist Cmax is the less than 100%. And there also occupancy. After the binding, the Cmax is the less than 50%, but full agonist Cmax 100%. Next, receptor classification. On the basis of property of the receptor is divided in four parts. First is the ionotropic, nuclear receptor, metabotropic receptor, ligand regulated, transmembrane receptor. Next, ligand gated ionic receptor. What is the ligand? Ligand means any protein molecule, any ligand bind, and after the gate is open and ions passes from external to internal. That is known as ligand gated transporter, ligand gated receptor. It also called ionotropic receptor, is the fastest receptor, and their example GABA receptor, muscarinic receptor, and glutamate receptor. Next, after that, their feature in the spore where from the position is ions passes from external to internal, that spore filled with the water, and it may be closed or open on the basis of binding of ligand, and after the movement of ion depend upon the ligand bindingness. The molecular structure that having the 4 unit alpha, beta, gamma, and delta, and it pentamers and the subunit arranged in a and such way. Next, this is the structure where alpha and alpha, 2 alpha, beta, gamma, and delta. This is the membrane, and they are subunits. After ligand binding, what will happen? You can see next slide. That after the ligand binding, the opening of the spore and ions passes from external to internal. From external to internal, this is the molecular structure that having the ionic channel. This is the ligand. After ligand binding, the ions passes from external to internal. Next, this is the molecular structure of the cell membrane. Next, and it can be explained by the good way by this diagram. That is the ligand and bind to that particular receptor. A gate is the close before the binding. After the binding, gate change the configuration of the ionic channel, ligand gated ionic channel, and open the gate and pass the ion from external to the internal, and that ion produce the cellular response. After removal of the ligand, again close the spore. That can be explained by the very good explanation of by this structure. Thank you. Next, this is the getting mechanism. GABA receptor. GABA receptor, the alpha and benzodiazepine bind to the benzodiazepine sites, and agonist GABA is a bind. Then configuration changes and collide and passes from outside to inner side, and that induced to the hyperpolarization, and due to hyperpolarization induce the sedation. Means a drug, diazepam or any L-blox drug, a benzodiazepine drug bind to that particular receptor, that induce the sedation by the mechanism of passing the colloid ion from the outside to inner side, ultimately induce the hyperpolarization. Next, what is the effect of the concentration of ions in your body? What is the effect? Only in ligand ionogated channel, there are 4 or 5 type ions: sodium, potassium, sodium, calcium, and chloride ion. If they increase the concentration of sodium and calcium, that induce the excitatory. If they decrease the concentration of sodium and calcium, that induce inhibitory effect. And increase the potassium ion inside of the cell, that is inhibitory effect, and decrease the potassium ion, that is the excitatory effect. In a similar way, if they increase the colloid ion inside, that inhibitory effect. If they decrease the colloid ion inside of the cell, that is the excitatory effect. So these ions can induce the effect on the body in a terms of excitatory and inhibitory. Okay, next. This is the important. What is the importance of ionic channel? The ionic channel play the important role for the generation, propagation of nerve impulses and synaptic transmissions of neurons, muscular contractions, and salt balance and hormones release. and muscle relaxation anti-agonic effect. These are importance of ligand-gated ion channel which play the important role in a nerve conduction, in the synapse, in the muscles, and the ionic balance and hormone release. Next, thank you for attention, and this video ionotropic will be explained in the next video. Thanks for attention.